Welcome back to Living Well, and Dr. Ken Stewart, who is here from KCU Medical Center. We appreciate you coming on. Brought a variety of items that we all should be eating or drinking more of, and that's for a great reason. March is Colorectal Cancer Awareness Month.
That is correct.
And the stats that you sent surprised me a little bit. I had no idea it was as prevalent as it is in the list of cancer.
Yeah, it's the third most common cancer diagnosis that's made in the United States. But here's the positive thing. I always want to start out on a positive note. And that is that if you get a good screening and you look for symptoms, you be proactive about it, you can actually identify it before it actually becomes a problem. So my personal story is when I started residency, I was having a little bit of blood in my stool, went to saw the GI doc, said, let's go ahead and do a colonoscopy. You're about 45. And sure enough, they found a pre-malignant polyp for me.
And how old were you? Can I ask how old you were at that time?
I was 45 at that time.
45.
Yeah.
When are men and women supposed to start that screening process? Because that does seem to change somewhat through the years.
Yeah, so 45 right now I think is what they're recommending. You have a colonoscopy done, and then obviously it's going to be if you have family history of colon polyps or colon cancer, or you've got those kinds of family histories, you're going to probably try to get screened much sooner and more frequently.
Okay, and let's talk about the frequency of screening as well, because again, when I first started getting colon cancer screenings, they were saying 10 years. Is that still the gold standard, or has it changed somewhat?
Yeah, so they're recommending 5 years.
Okay.
The only exception to that is unless you're really healthy and you're approaching your age 75, if you've got a good expectation of 10-year longevity, then you would continue having those colon cancer screens or colonoscopies. If you've got that, if you're beyond 75, you don't have to do it as frequently, maybe every 10 years after
and so
that.
I think that's a little confusing to a lot of people. Why is that 75-year mark, why does that do the opposite of what you think it should?
I think it's because, at 75, you got to ask, what are your options going to be?
Is it a quality of life situation?
It is.
Somewhat?
It is. I mean, we're definitely living older. More people are getting into their 80s and 90s than used to get to those ages. But you got to wonder, if you diagnose a cancer, what are you going to really do about it in those ages?
True. And
it's a quality of life issue, certainly.
Let's make sure that we go through some of the wonderful items you brought. You brought broccoli. Why are these so effective in your diet when it comes to colorectal cancer?
Yeah, they add fiber to your diet, and fiber is always a good thing to clean out the colon. And so, you can replace this, if you're having a lot of processed meats or smoked meats, things of high fat content, that puts you at a higher risk of getting colon cancer. So having a good fiber diet, more vegetables, more fruits, stop smoking. Alcohol is a contributing factor, losing weight, exercising, all of those things are going to contribute to longevity, good quality of health, and being able to keep that colon nice and cleansed out.
Okay, and one more question before we go, because this is the one that I think everybody wonders about. Give me the reason to do the full colonoscopy as opposed to the thing that you get in the mail that we see the public service announcements on all the time.
Yeah, I think it's important to talk to your doctor. If you've got risk factors that put you at a higher risk, I probably would recommend actually doing the full colonoscopy. If you've got low risk factors, you're in good health, you can probably get away with the screening tests with the cards that they send you in the mail. But talk to your doc, really important.
It is.
Yeah, absolutely.
All right. Doctor, thank you so much.
Gary,
we always appreciate you guys coming on, and
thank you.
I feel like every month you're keeping more and more of our viewers healthy.
Oh, wonderful.
Yeah.
Thank you,
Thanks.
Gary.